for my validation, I'm going to be performing trach suctioning and trach care. And first thing I'm going to do after entering the room, washing my hands, providing privacy for the patient, making sure that there's adequate lighting. I'm going to identify the patient by asking them their name and date of birth and verify that with their wristband. All right, that all matches up. I've already raised the bed up to a working height to save my back. Got my table lifted up. I'm going to explain the procedure to the patient. Today I'm going to be doing a tracheostomy suctioning and care, and it shouldn't take very long, should not provide any uncomfort for you. However, if you are uncomfortable at any point, please let me know, and I will make sure that you're comfortable before we continue. And at this time I put on my goggles. Already got the bed raised up. I'm going to lower the railing on the working side, and I'm going to go ahead and get all of my supplies, which I've already brought with me, get them all set up where I want them. Take off this normal saline bottle cap, and I will go ahead and open up my sterile field, pull out the sterile gloves, apply the sterile gloves, done. Take out the box with which I'll be putting normal saline in, and take out the catheter. Hold the hub in the palm of my right hand and wind catheter tubing. At this time, I'll go ahead and contaminate my non-dominant hand, pour some normal saline into the box, and I will turn on continuous suctioning between 100 and 120 millimeters of mercury. Take the suctioning tube and apply it to the end of the catheter without contaminating my dominant hand. And I will go ahead and clear the tubing. It's clear. I'll have my assistant, who would normally be here, hyperventilate the patient with 100% oxygen before going in. Will insert the catheter until I meet resistance, or the patient coughs, and then I'll withdraw the centimeter and go ahead and begin suctioning by pulling and rotating it around all sides. And as soon as I have taken it out, I will clear the tubing again, and I will have my assistant hyperventilate the patient again, and then I'll go in for my second pass. I will perform no more than 2 passes, and clearing the tubing in between and after each one. Alright, I'll clear the tubing one last time. And I will go ahead and turn off suction. Dispose of the catheter. And I will, at this point, the suctioning portion is over, and I will move on to the cleaning portion. And before I begin that, I will go ahead and remove the bandage. Get rid of that in my other glove. I will put all of these supplies down here in the waste section. I will move my cleaning supplies to the center of my table. Still have my normal saline right here. Open up the new cannula package, which I will be replacing the old one with. This time I go ahead and open up the sterile box, take out my gloves, putting on my sterile gloves. So as to avoid contaminating my gloves. Now position it how I want it, just like that. time, I will go ahead and get all of my cleaning supplies ready. Make sure I have enough 4x4s. Get my cotton swabs set up. And at this time, I will go ahead and contaminate my non-dominant hand to soak the cotton swabs. And I will stabilize the trach plate with my non-dominant hand, take a 4x4 of gauze with my dominant hand, and remove the old cannula. Dispose of that there. While holding onto the trach plate, I will take the new one, and I will insert it. And at this point, the sterile portion of this procedure is over. I am now performing under clean technique, and I will take cotton swabs, clean the stoma, top to bottom and bottom to top. Dispose of that. I will clean the trach plate in the same fashion. And I will put a new bandage there, after allowing the care to dry, of course. And I will replace the trach plate straps as needed if they're damaged, and make sure to cut them, not leave them on there. And that concludes the cleaning portion. I'll go ahead and dispose of all the materials. I will put it in the document, the patient's response to the treatment, and put it in the chart with the date and time and my initials, and see if the patient has anything else that they need from me. And if not, I'll go ahead and lower the bed. And I will make sure that the brake is on and the call light is in reach.